Welcome to the open enrollment presentation for Alliance Services of Texas. The benefits will begin April 1st, 2025 through March 31st, 2026. Alliance Services of Texas has partnered with Insurica to create a more personal experience when dealing with your employee benefits. Insurica is a resource for you and your dependents to call with any benefit, provider, or claims questions. All employees and their covered dependents have access to the Insurica team with help for claims resolution, benefit questions. Our business hours are from 8:30 to 5 p.m. Central Standard Time. However, we do understand that you are really busy and we're happy to help you before or after hours. My direct number is 512-381-8397 and my cell phone number is 512-680-6243. You may also email me at sandra.quintanilla@insurica.com. You may only make changes to your elections during the year if you have any of the following status changes: marriage, divorce, or legal separation, gain or loss of eligible dependent for reasons such as birth, adoption, court-ordered disability, death, reaching the dependent child age limit, which is 26, significant changes in employment or employer-sponsored benefit coverage that affect you and your spouse's benefit eligibility. Your benefit change must be consistent with your change in family status. Now, this is an IRS regulation. The IRS will require that enrollment due to the above qualifying events changes must be submitted to Insurica or to Alliance Services of Texas within 30 days of that qualifying event. In such an event occurs, please immediately contact Human Resources or the Insurica team. Blue Cross Blue Shield of Texas will be administering the medical plan for Alliance Services of Texas. The benefits that we will be reviewing in this presentation will be mostly in-network. However, you could see your plan document for out-of-network benefits. Now, before we get started, let's review a few key points. Deductible. The annual deductible must be paid in full before the coinsurance is applied. Please remember that copays do not apply towards your deductible. The deductible will remain per calendar year from January through December 31st. Keep in mind, if you have satisfied your deductible from January through March, your deductible will carry over to Blue Cross Blue Shield as long as you're an employee, full-time active employee with Alliance Services under United Healthcare. The Insurica team will be working with United Healthcare and Blue Cross Blue Shield to make sure that your deductible is carried over. The out-of-pocket maximum. Now, this is an in-network maximum as the member will have to pay under the health plan per calendar year, again from January through December, including the deductible and copays. For the out-of-network benefits, the member is also responsible for those charges above the usual and customary charges. Now, virtual visits allows you to seek medical attention when the provider through Blue Cross and Blue Shield partner MD Live virtual visit. This platform is available 24 hours a day, 7 days a week. The coinsurance. Now, after the deductible has been satisfied, the plan will pay accordingly to the coinsurance levels and according to the benefits for in and out of network coverage. Now, the coinsurance is the sharing of the cost between the insurance carrier and the member. The formulary drug list, each carrier does have developed a formulary, which is a list of generic medications and brand name medications as well. So it's important to go to the Blue Cross Blue Shield portal and verify and make sure where your prescriptions fall under. The telemedicine and telehealth visits allows you to continue to see your in-network primary care and specialist providers during their business hours virtually. Let's get started. The Medical Comparison High Deductible Health Plan is HSA compatible. The network is the Blue Choice Network. Blue Choice is the largest network with Blue Cross and Blue Shield of Texas. This plan offers you in and out of network coverage. Your deductible for an individual is $7,500 and for the family is $15,000. Keep in mind that your deductible will remain per calendar year from January 1 through December 31st, and it will reset come January 1 of 2026. Your maximum out-of-pocket is $7,500, and for the family is $15,000. The coinsurance is covered at 100%, so the insurance will pay 100% after your deductible has been satisfied. Preventative services are covered at 100%. Your primary care and your specialist visits all will go towards your deductible, including your mental health, behavioral, outpatient hospital, inpatient, emergency room, and urgent cares. Now, it's really important to make sure that your provider is contracted with the Blue Choice Network. You do not have to pick a primary care physician under your plan, and you do not need a referral to see a specialist. However, there are some doctors that do require the referral, and those include physical therapist, neurologist, rheumatoid arthritis doctor, and those are anything with an "is" behind it is a good explanation to find out if your doctor does require that referral. Keep in mind that the plan doesn't require it, it's just that particular doctor. Now, under this plan, you will not have any copays. You won't have copays for prescriptions as well, which we'll go over shortly. But keep in mind that you will have to pay up to the contracted rate until your deductible has been satisfied. So an office visit could cost $200 up to that $7,500. Once that $7,500 for an individual has been met, or $15,000 for family, then you're covered at 100% for the remainder of that calendar year. Keep in mind that you do have out-of-network coverage, but we want to focus in this presentation on in-network benefits. Health plan options for prescriptions. Preferred pharmacies offer lower prices. The Blue Cross Blue Shield High Deductible Health Plan has a $7,500 deductible. Keep in mind that you'll be responsible for 100% of those medications until your deductible has been satisfied. So it's so important for you to go to the Blue Cross Blue Shield portal to find out how much that medication costs, or contact your pharmacy to find out which medications are at a highly cost, or if there's a manufacturer coupon that you could use. Keep in mind that you'll be responsible for 100% of that cost until you have reached your $7,500 individual deductible, or for $15,000 for the entire family. Let's review the medical comparison copay plan. Buy-up plan option 1. This has a Blue Choice PPO network, which is the largest network with Blue Cross Blue Shield, and it has a $2,000 individual deductible. Again, your deductible will be per calendar year from January 1 through December 31st. Whatever deductible you have satisfied with United Healthcare will be carried over to Blue Cross and Blue Shield. The insurance team will work with both United Healthcare and Blue Cross and Blue Shield to ensure that the deductible is carried over. Keep in mind that it may take a few weeks before that occurs. The individual deductible is $2,000, and for the family is $6,000. The maximum out of pocket is $5,000 for an individual and $14,700 for a family. The coinsurance is 80%, meaning that the insurance will be responsible for 80% after your deductible has been satisfied, and you'll be responsible for 20% after your deductible. The primary care copay is $30 and a specialist is $60. You do not have to pick a primary care physician, and you do not need a referral to see a specialist. However, it's extremely important for you to have a primary care physician. There are some doctors that do require a referral. As I mentioned before, it could include cardiologist, neurologist, rheumatoid arthritis doctor, physical therapist, essentially anything with an "is" behind it. The mental health and behavioral outpatient, for behavioral health, it's a $60 copay. For outpatient behavioral health, it's 20% after your deductible for all other services. An outpatient hospital is 20% after deductible. Inpatient hospital is also 20% after your deductible. Emergency room, you'll be responsible for your deductible plus 20% plus a $500 copay. Again, extremely important to find out if that urgent care is actually truly an emergency room, if it has a hospital name behind it or in front of it, keep in mind that it could be submitted as an emergency room visit. Some of these urgent cares after hours are considered emergency rooms, so always ask and make sure that they're contracted with the Blue Choice Network. The urgent care is a $75 copay. You do have out-of-network coverage. It does have a separate deductible and it has an unlimited maximum out of pocket. You will be paying at what's considered a balance bill, so it can be over that $4,000 deductible. So it's always best to find an in-network doctor for all three plans or whichever plan that you're on. So it's really important to make sure that your doctor, your pharmacist, your emergency room doctors, your physicians and specialists are all contracted with Blue Cross and Blue Shield of Texas. The health plan options for prescriptions. The preferred pharmacies offer lower prices. Again, keep in mind that CVS is not in network with Blue Cross and Blue Shield, so you will have to go to Walgreens, HEB. Again, CVS is not in network, and then Walmart is another pharmacy, or even Kroger's. The preferred generic medications, $0 or $10 copay. Non-preferred generic is $10 or $20 copay. Preferred brand name is $50 or $75 or $70 copay. Non-preferred generic and brand is $100 or $120 copay. And the preferred and non-preferred specialist is $150 to $250 copay. Once you receive your ID card, you are going to see that higher cost on that ID card. However, at the pharmacy, you will be paying a lower cost if that medication falls, if you're in a preferred pharmacy, such as Walgreens, Walmart, HEB, Kroger's. So keep that in mind as well. Just they couldn't list all the costs of the prescriptions, but you will be paying a lower cost of the pharmacy as long as you go to a preferred pharmacy. If you go out of network, it is going to be subject to your deductible and coinsurance. So again, making sure that your pharmacist is in network and contracted with Blue Cross and Blue Shield of Texas. Now let's review the Blue Cross Buy-Up Option 2. It has a Blue Choice PPO network, again the largest network. It has a $5,000 individual deductible. You do not have to pick a primary care physician under this plan either, and you do not need a referral to see a specialist. However, there are some doctors that do require the referral. Again, those include rheumatoid arthritis, cardiologist, neurologist, physical therapist. Now, this plan has a $5,000 individual deductible. Family is $14,700. The maximum out of pocket is $7,350 and for family is $14,700. The coinsurance is covered at 80%. You do have a primary copay at $45 and the specialist is $90. Mental health is going to be at the $90 copay, 20% after deductible. Outpatient services are covered at 20% after deductible. Inpatient services are covered at 20% after deductible, and then emergency coverage is 20% after deductible with a $500 copay. Urgent care is a $75 copay. So keep in mind, it's really important to make sure that your doctors are contracted with Blue Cross and Blue Shield of Texas. If not, then you will have that out-of-network coverage and you can be balance billed. The health plan options for prescriptions. The preferred pharmacies offer lower prices. Again, keep in mind that CVS is not in network with Blue Cross and Blue Shield, so you will have to go to Walgreens, HEB. Again, CVS is not in network, and then Walmart is another pharmacy, or even Kroger's. The preferred generic medications, $0 or $10 copay. Non-preferred generic is $10 or $20 copay. Preferred brand name is $50 or $75 or $70 copay. Non-preferred generic and brand is $100 or $120 copay. And the preferred and non-preferred specialist is $150 to $250 copay. Once you receive your ID card, you are going to see that higher cost on that ID card. However, at the pharmacy, you will be paying a lower cost if that medication falls, if you're in a preferred pharmacy, such as Walgreens, Walmart, HEB, Kroger's. So keep that in mind as well. Just they couldn't list all the costs of the prescriptions, but you will be paying a lower cost of the pharmacy as long as you go to a preferred pharmacy. If you go out of network, it is going to be subject to your deductible and coinsurance. So again, making sure that your pharmacist is in network and contracted with Blue Cross and Blue Shield of Texas. Please review the cost comparison. The Blue Cross Blue Shield High Deductible Health Plan has a $7,500 deductible. Keep in mind that these contributions are per employee only for spouse, children, and family. You'll also have the option for the Blue Cross Blue Shield Buy-Up Option 1 with a $2,000 deductible for yourself, your spouse, children, and your entire family. And the Blue Cross Blue Shield Buy-Up Option 2 has a $5,000 deductible. Please review your employee benefits as well and take a look at the contributions for yourself, your children, and your family, as well as your spouse, for an effective date of 4/1 of 2025. Preventative services are covered at 100% for all the plans, as long as it's coded as a routine. Now, this includes, but not limited to, the annual physical exam, well woman exam, certain vaccines, and specific procedures based on your age. Here are a few helpful medical tips. Register online at www.bcbstx.com. Use the BCBSTX app, and also ask your provider for samples for this medication. A great example is that my daughter needed an asthma medication, and it was almost $800. We asked our provider, and her provider gave her a sample that lasted almost a year. Now also ask your pharmacist questions. They may know manufacturer coupons or any other discounts that are available. Another helpful tip is the Good RX. You could download it on your mobile device, or you could use it on your laptop. And then, of course, knowing the difference between the urgent care versus emergency room. A lot of emergencies are popping up and they look like an urgent care, or they may be an urgent care before hours, and then after hours they're considered an emergency room. So anything that has a hospital name on it, or if it has an ER, then it's going to be billed as a hospital visit. And while you are traveling, it's always important to go to that Blue Cross Blue Shield app and make sure that your provider is in network, and also make sure that the closest urgent care is considered an urgent care. Now, know the difference between the virtual visits versus telemedicine. You could have your telemedicine appointments through MD Live, or your virtual visits with your primary care physician, or even your specialist. Using your virtual visits through MD Live is so important. You could seek your general health, pediatric care, and even behavioral health. Now, virtual visits are convenient health care at your fingertips. Virtual visits through MD Live. There's various ways that you could connect through either your computer, smartphone, tablet, or even your telephone. You could visit the website at mdlive.com/BCBSTX. You could choose a doctor, you could do a video chat with the doctor, and then you could also have access through the portal through Blue Access for members. You could interact in real-time consultation with a board-certified doctor or even a therapist. Now you could use your mobile app, you could download it, the MD Live. Now I do encourage everybody that's enrolled in the Blue Cross system, whether it's your spouse or your dependent children over the age 18, to download that app. In the event that they are sick, whether they're traveling or in college, they have access to MD Live at their fingertips. You could get immediate diagnosis. Prescriptions are sent electronically to the pharmacy. I do encourage you to do a little bit of homework and make sure that the Walgreens pharmacy is open 24 hours. Some of the providers or pharmacists their store is open, but not the pharmacy. So that's another little helpful tip. Once you receive your ID card, you would want to register on the Blue Access for members. You will need your first name and last name, your date of birth, and your Blue Cross and Blue Shield member ID number. You could also call MD Live as well, and you could go ahead and schedule an appointment. Blue Cross Blue Shield has a mobile app, your health plan at your fingertips. Now, with this Blue Cross Blue Shield app, it features you could find an in-network doctor, hospital, urgent care facility, and search for Spanish-speaking doctors. You'll have access to your claims, coverage, and deductible information. You'll also have access to a temporary digital ID card. You could secure with your Face ID or even your fingerprint, and it's available on any iPhone or Android users as well. Now, choosing the right plan can be difficult. I'm sure you're deciding which plan is best for me. You should consider how you use your plan, including preventative care and prescription drugs. How often do you go to the doctor? Consider your cost per paycheck monthly and even annually. And consider what's important to you in your medical plan. Physician and drug copays, deductibles, and coinsurance, or is this more for a catastrophic coverage? Keep in mind that the Insurica team is here to help you and to support you in deciding which plan works best for you. You may reach again Sandra Quintanilla to help you answer any questions or concerns that you may have regarding your current benefits, or even with Blue Cross and Blue Shield, or even your family's plan. The dental plan will be administered by Unum. The dental plan will be administered by Unum. You have an individual deductible of $50, and for a family is $150. The deductible will be waived for preventative services. The calendar year maximum is $2,000. Now let's pause for a moment because this is a little bit different than the medical plan. If you have already used your maximum out of pocket with United Healthcare, effective 4/1, you'll have a new $2,000 maximum, and that from 4/1 through December 31st, you'll have that calendar year maximum with Unum, and then it will reset from January 1. So from January through March, you will use your United Healthcare. And let's just say, for example, you've used your $1,000. Effective 4/1, you'll have a new $2,000 from 4/1 through December 31st, and that $2,000 will reset come January 1. Preventative services are covered at 100%, basic services are covered at 80%, and major services are covered at 50%. Now this does include implants, which is a little bit different in the years past. Keep in mind there is a missing tooth clause, so please let us know if you have any questions regarding that procedure. The endodontics and periodontics is covered at 80%. We do have orthodontia coverage. This is new. The child up to the age of 19 at 50%, and the orthodontia lifetime benefit is $1,000. So if they used the ortho with the previous insurance, unfortunately, this is it cannot be used again. Again, even though it wasn't with Unum and it was with another provider, this is a one-time lifetime maximum of $1,000. You do have the weekly rate for yourself, your spouse, children, and your family. We do focus on in-network. However, if you do go out of network, you can be balance billed. So it's really important to make sure that your dentist is contracted with Unum. Using an in-network dentist ensures that you get the best benefits. The chart above illustrates the in-network versus out-of-network coverage. Here's the example. The in-network dentist agrees to a set contracted rate from Unum. As you see, the preventative charge is $150. The amount that Unum pays the dentist is $80, and your responsibility would be $0 since preventative services are covered at 100%. For out-of-network dentists, they can bill you the amount over the contracted rate. This is known as balance billing. So the same preventative charge of $150 for out-of-network, the contracted rate is $60, and you'll be responsible for $90. A couple of helpful tips. The dental cards will be available on the Unum portal. Using an in-network dentist is best. Teeth cleanings are every 6 months, and make sure the dentist does a pre-estimation or predetermination when the treatment is expected to exceed over $300. Always ask if the dentist is contracted with Unum. Do not ask, do you take Unum insurance? 99% of the time they will take it and process the claim out of network. So it's extremely important to make sure that the dentist is contracted with Unum. The vision plan will be administered by Unum. The vision plan will be administered by Unum using the Vision Care Network. For the exam, you'll have a $10 copay. Frames, you have a $130 allowance, 20% for the amount over. For lens, you have a $25 copay. There's UV treatment, tint, and standard plastic scratch coating that's available under the copay at Walmart only. You do have contacts, standard contacts, lenses, fit, and follow-up is a $25 copay. And contacts as an elective is a $130 allowance. Keep in mind that it's either contacts or frames. It's not both. The frequency for the exams is once every 12 months for the exam. Lenses is once every 12 months. Contacts and frames are once every 12 months. So again, it's for the vision plan will cover glasses or contacts, not both. It's always important to make sure that you go to a vision provider that's with Unum as well. You do have to make sure that you are at a participating doctor provider. If you go out of network, you do have to file a claim separately. So it's very important to search for a provider that's in network. Again, Walmart is covered, and you'll be paying a copays for UV treatment, tent, or standard. If you go out of network, it's not covered, or any other provider, it's not covered. Basic life, voluntary life, and accidental death and dismemberment will be administered by Blue Cross and Blue Shield of Texas. Basic life and accidental death and dismemberment coverage are provided at no cost to you. You're automatically covered with $30,000 life insurance benefit. This includes AD&D, and this helps protect you and your family for unforeseen financial hardship of a serious accident that causes death or even dismemberment. At age 65, the benefit will reduce by 65% of the amount. Additional age reductions do apply. Designating a beneficiary is extremely important. A beneficiary is the person or entity you designate to receive the death benefit of your life insurance policy. You can name more than one beneficiary, and you can change your beneficiary at any time. If you name more than one beneficiary, identify the share for each. Voluntary life and accidental death and dismemberment is also available. To supplement your employer-paid life insurance, you can purchase additional life and AD&D coverage for yourself and your dependents. The benefit outlined are provided on the voluntary basis by Blue Cross and Blue Shield of Texas. The employee has a minimum amount of $10,000 and the maximum is $300,000. The guaranteed issue is $100,000, meaning that you do not have to fill out any medical questionnaires and you're automatically guaranteed the $100,000 for your beneficiaries. Keep in mind that it is so important to make sure that you elect your $100,000 now, because next year you would have to fill out an evidence of insurability. So it's really important to take advantage of that guaranteed issue of $100,000. The spouse, the guaranteed issue is $20,000, and for the children, it is $10,000. The 14 days is for the children up to the age of 26 if a full-time student. So keep that in mind as well. Employees of Alliance Services of Texas are eligible and have a one-time opportunity to purchase life insurance up to the guaranteed issue amount without any medical questions. The guaranteed issue amount this year is $100,000 for the employee and $20,000 for the spouse. During open enrollment, you can purchase this life insurance without having to prove that you're in good health. After open enrollment, employees will have to complete the evidence of insurability. Next steps. Log into the EASE Benefits portal and select your benefits. Everyone must enroll or decline on the EASE portal. Open enrollment deadline is Friday, March 21st at 12 p.m. Now let's remember the qualifying event. You may make changes to your elections during the year if you have one of the following status changes. This includes marriage, divorce, legal separation, gain or loss of eligible dependent, or reasons such as birth, adoption, court order, disability, death, and reaching the dependent age limit of the age of 26. Again, children are covered up to the age of 26 regardless of student status or even marital status. So having a child married with 3 children could still be covered if you claim them as a dependent. Significant changes in your employment or employer-sponsored benefit coverage that affect you or your spouse's benefit eligibility. Your benefit change must be consistent with your family change in family status. And then this is an IRS regulations that will require for enrollment due to a qualifying event above. Now, changes must be submitted to your benefits office within 30 days of that qualifying event. The Insurica team is here to help you. Our business hours are from Monday through Friday, 8:30 to 5 p.m. Central Standard Time. However, myself, Sandra Quintanilla, I have my direct number listed here at 512-680-6243 or my office number at 512-381-8397. Please feel free to email me, text me, or before, after hours, or even on the weekends if you do have any questions or concerns. We're here to help you and to support you. Thank you so much for participating in the open enrollment presentation for Alliance Services of Texas. Please do not hesitate to reach out to the Insurica team if you have any questions or concerns regarding your employee benefits. We are here to help.